Thank you, everybody. Good afternoon. Thank you for taking the time out of your day to come here with us and spend the afternoon learning with Sovereign Health, learning a little bit about our treatment facility and about one of the many programs that we offer here at Sovereign Health, not only at headquarters in San Clemente, but we also offer neurofeedback in Rancho San Diego, Chandler, Arizona, and soon Fort Myers and Culver City. So we'll start by showing you a brief video, little introduction that we usually show our families whose children, kids, family members are in treatment.
Hi, this is Mike Cohen. I first took my dad to neurofeedback in 1995. He was struggling with severe agitation. We went to top doctors, nothing worked. Then we found neurofeedback and the effect on him was remarkable. Ever since, I've worked with neurofeedback. So when people ask, what is neurofeedback? They typically want to know how you do it, what it helps, and how it's different than other options. With neurofeedback, anyone can improve their brain. We've trained children, teenagers, and adults from age 2 to 92. For children, it's often used for ADHD, emotional and behavioral issues, learning and developmental delays, and struggles in school. For adults, it's commonly used for anxiety, depression, obsessing, and sleep problems. Neurofeedback measures brain activity, like brainwaves, and it helps you make more or less of certain brain patterns. By changing brain activity, or by changing how one area of the brain talks to another, you can improve attention, control of your emotions, and behavior. There's research on how it helps migraines, pain, concussions, addiction, and seizures. But what do all these have in common? They're brain issues. With neurofeedback, your brain changes itself. And when it does, typically any of these issues improve. It's not all about problems. Neurofeedback improves performance by changing the timing of the brain. That can help anyone in performing in school, business, or sports. It helps give you an edge. Neurofeedback is different from brain games like Lumosity or tutoring or therapy. Those focus on changing your skills or behavior or how you think. Neurofeedback is focused on changing the brain. There are parts of your brain that help you pay attention, that help you be calm, that help manage your mood and your emotions, or that help you sleep. You don't realize how much your brain affects your mind. With neurofeedback, you get to see how changing your brain can have a huge impact on your life. How do you do neurofeedback? First, we put sensors on your head. Commonly, we measure your EEG brain activity with a special computerized system. The system gives you feedback, such as playing a movie or hearing a beep. For example, when you make a certain amount of beta brain waves, the movie will play perfectly. But as soon as you're less alert and awake, the movie starts to fade out. You rapidly learn how to keep the movie from fading out by changing the brain activity that's being trained. Your brain has a way of figuring out how to get the movie to play. Once you learn new patterns, and that may take practice, your brain tends to remember it. There's a lot of published research that shows that the brain learns from feedback and that measurable changes in brain activity occur after training. So how do you change your brain? It's just learning. Children learn to play a video game, and they never read a manual. Their brain figures it out. How do you balance on a bike and not fall over? Somebody probably showed you, but it's your brain that figured out how to balance. When you train brain activity, your brain figures out how to balance its own activity. So once you train the brain, does it stick? Well, you don't forget how to ride a bike, even if you hadn't ridden in 10 years. It's the same with neurofeedback. Once your brain learns, you don't tend to forget it. There are exceptions, particularly if there's disease like Alzheimer's or neurological issues, but there are still ways to train your brain. The changes you make with neurofeedback can over time have a profound effect on learning, memory, attention, mood, migraines, and far more. If you or someone you know could benefit from improving their brain, we encourage you to learn more. You can visit our website at centerforbrain.com.
Neurofeedback we want to describe to you. Neurofeedback measures brain waves to produce a signal that can be used as a feedback to teach self-regulation of brain function. It monitors, as the movie describes, we set up a patient with sensors to the brain and we connect them to the brain paint system, and it sends the brain information via these brain waves. Neurofeedback is like learning how to ride a bike. Although you learn how to ride a bike, from the learning that takes place early in age, it's something that sticks with you, but the more you ride a bike, the better you are at it. And that's what neurofeedback tries to do with certain behavior. It increases the pattern of neurons, what goes on in the brain, to make sure that you don't forget how to ride a bike. You may learn how to ride a tricycle to begin with, but with enough practice, you could ride a motorcycle, because that is the growth of, say, a bike cycle. Our brains learn from experience, and neurofeedback provides an experience that the brain can learn from, and it can grow from, and it can strengthen. A little history of brain paint. Brain paint uses the exact protocols, and by protocols we mean not everybody's brain works the same, on the same level. We all have the same brain, but each of us have different capabilities, different skills, different things that we would like to improve. So depending on what we are targeting, what types of behaviors we would like to improve, what types of things we would like to strengthen cognitively, or what kind of symptoms we would like to decrease, for example, triggers. We use different protocols depending on the individual's goals. So in a study that Brain Paint, the neurofeedback system that we use here at Sovereign Health, their protocols have been scientifically proven in a large UCLA addiction study. And for those interested, you can see us after, and we can send you a copy of that research that was done with UCLA. This study proved that neurofeedback complements other treatment modalities to improve retention and the odds for long-term sobriety, and from 77% to 44%. They used a population that had difficulties with substances. Specifically, the patients that participated in this study had improved treatment retention, reduced resistance to other treatment modalities already offered. They were eager to continue in treatment. Their abstinence rates improved, and their compliance to aftercare improved. They really wanted to maintain what they were feeling while they were engaged in treatment, which included neurofeedback, brain paint specifically. And 3 of the protocols that we use, the evidence-based protocols that we use at Sovereign Health, one is the beta SMR. And this protocol is evidence-based treatment that yields the greatest effects for cognitive dysfunction to incorporate into brain paint. And it's a level of feedback that is given. What is nice about the brain paint system is that we don't have to tell it how much beta, how much theta, and we'll get to that, how much specific waves we need to get to the goal, the targeted behavior, the targeted level of functioning that we need. The system does that for you. We just enter in information via an intake on the patient and the different areas they would like to improve. We call them growth areas. For example, if they have anxiety or social anxiety or difficulties with anger, difficulties sleeping, insomnia, we take a very good intake and identify these areas that they would like to improve, and then we find a protocol that's best for them. The 3 protocols that we choose for, the beta SMR, the alpha theta, which is the most effective, evidence-based, and the most popular protocol for addiction and trauma. It has yielded the largest effects on all domains of psychological functioning per the most rigorous tests. And this is all information that we can show you that was used in the UCLA study. And an assessment tool for protocol selection. We have Brain Paint help us, the program. We enter in the information, and we used a manualized version of the UCLA 2005 study. The do's and don'ts of neurofeedback training. Neurofeedback training, again, is not therapy or treatment. We like to call it training because we are training the brain to react differently to different stimuli. It is like the movie said, it's like learning how to ride a bike. The more you ride it, the easier it is, the more your brain remembers, and that's what we want to do for certain behaviors. So in neurofeedback, we don't want to call it therapy per se, we want to call it a retraining of the brain. We like to tell our patients at Sovereign that their brain is going to the gym because it's exercising, which it is. We set the patients up to the system, and if they're having problem with attention or concentration, they will get feedback from the brain paint system because they have lost concentration. So they will hear sounds, they will see different visualizations that will get them to come back to the original task. And we will show you later how this works, but it feeds information from the patient back to the brain to let them know you're off course, you're off target, let's get back to the original goal, which was concentration and attention. A basic EEG for morphology. Here is some of the waves that you see, and during any session with a patient, you will be able to see at the bottom where their different waves are. So what our technicians do is not only do they set the patient up to the neurofeedback system, they are able to view, as is the patient, their brainwave activity. So we'll be able to tell if they are clenching their chin, if they are anxious, if they are withdrawn. We like to keep an eye on our patients because a good part of deciding how long we're going to set the patient up is the patient. Can they tolerate 10 minutes on the neurofeedback system? Are they more advanced? Can we spend 20 minutes with them? But this is something that we do by sitting close to them and monitoring their EEG waves. And this is just a brief synopsis of some of the different protocols and some of the different beta waves and what they will look like. You can see in a conscious mind at the very top, normal waking state consciousness. The patient is alert, you're concentrating, you're focused, you're cognitive, and the 5 physical senses are intact. Not one is overriding the other. And that's what the frequency, the beta waves, would look like. If you are in a deep relaxation state, say you're meditating or you're close to falling asleep, your alpha waves tend to largen, tend to move at a slower pace. The subconscious mind, as you see in the 3rd theta waves, it's usually in a state of barely conscious where you're about to fall asleep, you're entering REM state, and that's what your theta wave would look like. Unconsciousness, you'll see at the very bottom, is very, very little activity in the delta waves. What we want to try and do for our patients is find a combination of those waves to help them function better and improve their quality of life. That is what our goal is. We understand that they come to us because things are not going well for them, so we want to try and help them and attack their problem in a different way, help them on a different level. There are 5 different brainwave states at any given time. You'll see beta, it's more of the thinking, busy wave. Alpha is the more relaxed, self-introspection wave. Theta is the state between awake and sleep, deep meditation. And delta is the unconscious. Beta is the activating brain wave, and it's like drinking coffee. It's the one that gives you energy. It helps you to focus better. It is fast and it reflects. Oftentimes, some of our patients have too much beta wave and they're very, very anxious. So what we want to do is try and lower the beta wave. And again, this isn't something that you would do as a clinician, as a neurofeedback technician. This is something that would be set up to you with the protocol that is suggested by the system, the creator of this program. So it's fairly simple. I mean, and this is information that I'm going over with you to understand it a little bit better. It's a bit complicated, but what's great is the system is not complicated, because the most important part of selecting a good protocol for a patient is making sure you take in a very good intake, understanding from the patient's perspective, not his chart or his clinician or his mom or dad or his wife. We want to hear from the person what is most detracting from your life, because they will tell you in their words what is preventing them from being happier, from living the quality of life that they want to. Because we know if people are happy, they aren't going to turn to substances, turn to behaviors that have proven unhelpful and unhealthy for them in the long run. So what we're trying to do with neurofeedback is try and teach them to get to that meditative state where they can make clearer decisions, they can live a more fulfilled life because they're not anxious, they're not upset, they're not angry, they can focus, they can really attend to the moment. And what we're trying to get our patients to do is live in the moment and not think about what is going to happen in the future that's going to stress them out, or what happened in the past that they need to attend to. So we want to try and get them to live in the moment, and that's what brain paint does. It keeps you focused on the task at hand via the feedback that is given from the system. And the SMRI, it's a subjective feeling state. It helps you relax. It's associated with task and behaviors, and its physiological correlates inhibit motion, restraining the body may increase. So this is something that's produced by the brain, but we try and regulate that based on the protocol that we select for the patient. Every patient is differently and their needs are different. So again, the important part is a very thorough intake so that the protocol can be selected, and then we can start running sessions for the patient. Alpha waves. Alpha waves are slower and larger. Alpha waves are the strongest over the occipital cortex and frontal cortex and is higher in the right hemisphere of the brain. Alpha occurs when the brain shifts into an idling gear, relaxed and a bit disengaged, alert but not actively processing information, waiting to respond when needed. Closing your eyes while picturing something peaceful as well as deep breathing increases alpha. Thinking or calculating decreases alpha. Some of the protocols that we use will require that the patient close their eyes because it'll be easier for them to access these alpha waves. And some patients need more alpha waves in their life to help them attain the goal or reach the level that they are looking to achieve. So it's a combination of alpha and beta. Some patients need more beta, other patients need a lot less beta. So these are things that aren't decided by the clinician, aren't decided by the clinical team, but are decided by the brain paint system. And this a little bit more about alpha and the associated task. Ideally, going back to alpha, alpha is a meditative state. And what we want to teach our patients is, this is great, you're in treatment, you're getting help, you're motivated to feel better. We want to teach them that they can do these things outside in the real world, and it's called meditation. It's learning how to take a time out when you feel stressed out, when you feel overwhelmed. So we don't want them to feel that for the rest of their lives they're going to be need to be engaged in some type of neurofeedback. This is training their brain, but these are also things that they can do on their own with meditation, with mindfulness. So we want to equip our patients with the skills and the tools to be able to do these things on their own. But we know that at the moment they're in crisis and they need some extra help, and that's why we are here. And there are some drug effects on the EEG, because we know that most of our patients in treatment at Sovereign, they are on medication, so we are mindful of what they are taking and when they are taking so that they don't affect, or we figure out how to get them the best protocol that complements the pharmacology treatments that they are using. But this is just a list of some of the drugs and the impact on the EEG. We've had a couple of cases where we've selected a protocol for a patient, and because of other reasons, their clinical team has changed their medication, and it very much changed their EEG. So we had to accommodate the protocol to make sure that it was in line with the medication they were taking. So there are some rare instances where we would change a protocol on a patient, but usually the one selected is the one best for them, unless they have a major change in their medication. Neurofeedback is used for several different ailments, several things to help increase functioning, not only ADHD, addiction recovery, chemotherapy. It's helped with stroke recovery. It really helps with anxiety and stress. We haven't seen a whole lot of autism and Asperger's at Sovereign Health, but from the literature, it helps a lot. Brain injuries, we have had some TBIs. Chronic brain, we get quite a bit, and depression, it really, really helps. Fears and phobias, headaches and migraines, and insomnia. One of the first comments that we get from our patients after a couple of sessions say they had the best sleep of their life. And they really can't explain it. We ask them, we don't really go into any of this beta wave and understanding to the patient because we don't want to confuse them. What we want them to do is be motivated to try something new because whatever has happened in the past has not been working for them. So we encourage them to come see us, talk to us, let us tell them a little bit about neurofeedback and have them try it out. And they like it. After a couple of sessions, they sleep better. We notice them, they are in better spirits when they come see us. A few times they come early for their sessions. A couple of times their insurance company has tried to cut their stay with us, and they are advocating for themselves, something that usually doesn't happen with our patient population, advocating for themselves to be able to stay longer so that they can complete their 12 sessions. Ideally, what we like to do is see a patient for at least 12 sessions, because from the program creator of brain pain, he believes that is the golden number. Anything below that will have some effect, but in order to have the best effect, we need at least 12 sessions, ideally 30 for long-term effect, but 12 will definitely help the patient get through rehabilitation and help them find resources outside to be able to continue their path in good health and abstinence. There are some exclusionary criteria for patients that are not good candidates for neurofeedback for the program. And one is just a basic non-interest. We're not in the business to hunt patients down and force them to come see us. Usually our patients are eager to feel better, eager to try something new, especially something non-invasive. We don't take blood from them. We do a scan of their chart, but we don't really talk to them like the stereotypical clinician. We want to hear from them what is going on in their life that is preventing them from being the person that they want to be, functioning at the level that they want to function. So we take a different approach, a more holistic approach, a less invasive approach. So if a patient comes to us and they are not interested in what we're talking about, then that is not a good candidate for neurofeedback because they really need to be motivated to stay in our program and do well. If they are currently in detox, that is also an exclusionary criteria because we know that they have to spend a lot of time under supervision. And any active psychosis because they are at times listening, they have a headset and they're listening to noises, different types of music, and they are seeing very visualizations. Some are odd, some are beautiful, depending on what the person is at a neuronal level. We don't want to activate psychotic break, so we'd like our patients to be stabilized on their medication as far as psychiatric symptoms. And active seizures. They can have a seizure disorder, but as long as they're not actively having seizures, because they do see different things on the system, visualizations, we don't want to reactivate a seizure. So those are just our exclusionary criteria. There is lots of scientific rationale on how neurofeedback works. It's worked with several different populations, including the military. I know that sports figures use neurofeedback to help them with concentration and attention. And it gives you this feeling of being in control. We don't really know exactly how it works. That is more on a different level. But what we do understand is it works. We get very good reviews from almost all of our patients. Our program has a very long waiting list because everybody wants to try it. Word of mouth is a big deal because they see the people that they share homes with. They see how different they are, how different they feel. So we get a lot of patients through seeing how well it does for others. But it teaches them, in a nutshell, self-regulation, how to help yourself make better choices, how these choices will ultimately make you feel better and put you back on the track where you wanted to be, not where, unfortunately, you are currently. And neuroplasticity. Neuroplasticity is the brain's ability to change itself. And we know that our brain is extremely powerful. We know it through compensation. We know it through lots of studies. We've learned a lot about this in college. We know that when there is damage in the brain, the other side of the brain takes over and really manages what needs to be managed via the brain. So we know that with neurofeedback, we can change patterns. We can make things stronger. The good patterns, for example, the riding the bike. We want to teach people how to be able to make good decisions, how to give them that extra second or two to be able to decide, is this something I want to engage in? Is this something that's going to help me better my life, help me get to where I'm at? And that's basically what neurofeedback does. It retrains your brain via the feedback from the system. And brain paint, that is the name of our neurofeedback system that we currently use at Sovereign. There are lots of different programs out there. I'm sure if you Google it, you will find many. The one we use is brain paint. And here is just an example of how it works. But it's continuously auto feedback, visual feedback, and it shows you some of the things that are going through your head. You will see some of the different visualizations on the brain paint system. You can tell if a person's having a hard day because you will be able to see the screen and see some of the things, some of the colors and some of the visuals that are coming up. You will also see when someone has reached the meditated state, which we call crossover, where they're at the optimal level with the beta and theta waves, and they will be more relaxed. In fact, after about 5 or 6 sessions, the patient actually reports, wow, I had like 3 crossovers today. They can tell you that they felt better and they notice it. And some of the co-occurring disorders for neurofeedback, some of the things it helps with. And we know that when people are under stress, it really, unfortunately, bad behavior usually happens when we're under a lot of stress because we're not thinking clearly. We have so much on our mind. So what neurofeedback tries to do is helps you manage stress better, if that's one of the things that you're hoping it's going to help with. The important part to remember is with neurofeedback is you really need to capture the things that you want to change. That's why when we do presentations and people want to make up a fake person and fake problems, it's not really going to help because once we set you up to the system, it's going to read your brain waves, not the ones that you pretended to create in this individual that is sick. So we're just creating a protocol for a patient, and then we will run a session so that you can hear some of the noises, some of the feedback, some of the information that's fed back to the patient from the system. And it varies greatly depending on the patient. For example, if the patient is bipolar, we would use a completely different system.
So what you want to do is basically quantify how often this episode occurs. And you also want to ask them how it impacts their life. Someone who's battling with depression may be may become antisocial. They may not really like their quality of life. They really don't want to go out. They're not talkative, and it really deteriorates from them to be able to enjoy everyday life. We do this about 4 times. We do a growth area 1, growth area 2, 3, and 4. So patients basically just sit down with us, and the process takes about an hour to just identify the issues that they may have. Sometimes the issues may be an underlying factor as to why they are battling with addiction. Sometimes patients may say, well, the reason why I take, let's say, meth or cocaine is because I want to feel like I just want to numb out, or I want to, just get away from what's happening right now. Well, the overlying factor, the primary factor is depression. They're depressed about how their quality of life is. Next, the screen pops up. After you press next, there's going to be an age, where we're just going to say 18. You specify how old the patient's going to be. Female, we'll just say no. And then this is what happens. So we have the questionnaire that pops up. If the patient has convulsion, wakes up during night, and we go through the patient and what they may experience on a day-to-day basis. And then we press the correct and get protocol. So right now the system is going to evaluate a patient file that we had already previously made, so that way you can see what a session looks like.
So we're going to show you a protocol. It's non-linear, and this is a diagram of where we would put the sensors. It depends on the areas that are identified in order to, the areas identified that are in need of help, we have sensors that we put on depending on those areas. So for this nonlinear protocol, we're showing you an example of where we would put the sensors. And there are protocols where we're identifying concentration. So we would ask them to use the blue screen on the right-hand side, that elongated tube, and they would press a button every time they saw that so we could see where they are at their concentration. If concentration was a factor in interfering with their life. Depending on what it is they say that they need, the protocol will dictate whether we use the concentration component to measure their level of concentration, attention. It varies. It could be as short as 10 minutes if that's all they can tolerate. And because this is similar like taking your brain to the gym, they get tired very easy. So some people can only take 10, 15 minutes. Other people advance up to 30, 45 minutes. The more you come, the better they get, the more that they can take. There has been instances where patients have to be discharged and we want to get them their 12 sessions. We have done 2 sessions in one day. But ideally, we like to spread out and do 3 to 4 sessions a week. We charge the insurance. Originally, we were asking for patients to pay up front, but a lot of the patients that come to Sovereign, they don't have a lot of money to do that for the ancillary programs. So we've started billing the insurance companies directly, and usually with their verification of benefits, insurances pay anywhere from 30 to 60% of the charges, and it's a combination of EEG, CPT codes, therapy, CPT codes, testing CPT codes, because usually at visit 1, 6, and 12, we administer the SCL-90, which is the symptom checklist. We like for the patient to be able to rate how they feel on the day of intake, how they feel midway during treatment, and how they feel at the end. And usually you can tell that there is a decrease in all of the symptoms they originally reported. It's something that we like to track for us to make sure that we are doing a good job, and also something to show them that it's working. Because this isn't something we can really explain as far as the interaction with the beta wave, the theta wave, and how it is affecting your brain. But what we can explain to them is that on Monday, your first day, your level of anger was extremely high, and after the 6th session, it has gone down a significant amount. So they know that they're feeling better, but they really can't understand why. And there's different areas of the brain, going back a little bit to information on the program. There's different areas of the brain that are known to regulate certain behaviors, emotions, and that's where we decide where we are going to put the sensors depending on what the patient reports. So the different areas, we go with the Brodmann areas, and we use the 3 main sites, TC3, TC4, and PZ. We usually use our hand. We do have it's like a yardstick that we have, because some of our techs have bigger hands and smaller hands than others, but it's usually halfway through between the very tip of the head to where the ear is, these 2 areas where we would put the sensors in. We use some new prep to make sure that we can get it to stick there. Nothing will damage your hair or your color or anything. And the areas and a little bit about what they target. The PZ area is the attentional shifting, the perseverance, self-awareness, orientation area, apraxia, agnosia. The TC3 area is more of the sensory and the motor functioning, language comprehension, verbal understanding, long-term memory, episodic processing, event sequencing, visio-declarative realization. The amygdala, the hippocampus are involved in the TC3 area. The TC4 area is more sensory and motor functioning, personality, emotional tonality, categorization and organization, visualization, and auditory cortex. These are some of the areas where we put the sensors depending on what the patient identifies as some of the things that they want to improve. And then the session where we actually set the patient up to the protocol is the feedback, where we sit there and we get feedback based on brain activity. We try and get them to refocus depending on what it is going on for them that day. So that's when the training begins. And here are more of the 3 protocols. This is kind of our cheat sheet of the protocols that we use, the areas, the sites that we need to place the sensors, and then the common descriptions of the things that they target: attention, concentration, mood disorders, speech issues, brain damage. And then during the session, the patient becomes more in tune with info regarding states of focus, thoughts, and emotions, because they understand that when they're hooked up to the system, if they lose focus, the system will let you know, because you'll hear a series of very odd sounding noises. You'll see visualizations that don't really make sense, and it kind of alerts the brain that there's something wrong. So then they will relax or declench their teeth and try and refocus on the task at hand. And then you'll be able to see that immediately on their EEG and on the visualizations that are shown on the computer screen. We went over a little bit about the SCL-90 and some of the areas that it assesses. We like to do that 3 times during the 12-session package, is what we call it, so that we can see where they are at and what has decreased, what has not decreased. And then we start asking them, if we get an SCL-90 and we have an increase in, say, paranoia or hostility, we try and talk to them to find out, could this be a protocol issue? Oftentimes it's because earlier that morning they had a family session. It's Friday and the family usually comes in. It's something going on outside. But we very much like to keep in good communication with our patients so they can tell us what is going on for them. In order for us to better help them, we need to know, is this patient okay doing 20 minutes today, or has it been a really, really rough weekend? Did they get some bad news? Should we limit it to 10 minutes for today's session? So it's very prescribed depending on the patient. We don't have, session 1 is always 20 minutes, session 2 is always 40 minutes. It very much depends on the patient and what they can tolerate. And some of the finding of the neurofeedback research on opiate addiction and eating disorders. Eating disorders is a fairly new program that we have at Sovereign, so we wanted to do some research on the effectiveness of neurofeedback and eating disorders. So we wanted to share that with you, that it does make an impact, not only on drug addiction, but on eating disorders. And again, these are with people who are motivated for the program and continue to come to sessions. We do have the handful of patients that sign up very excited, and after 2 or 3 sessions they will drop out. But unfortunately, these are some of the patients that usually drop out of treatment altogether and stop going to groups, stop going to their therapy sessions, stop taking their medications. And we hope that we can catch these people when they come into treatment, when that window of opportunity, when they're very, very motivated to feel better, because most of our patients stay in treatment and get a lot out of the neurofeedback program. Thank you everyone for coming and your attention. And like I said, this is it's a very complicated, neurofeedback is very complicated, but the non-complicated part is the program. The program does almost all of the work for you. Our job is to recruit the patients, do a very, very thorough intake, and it kind of works on its own, and it's an invaluable resource.